Libertas PT, we designed our practice to be patient-focused. So the great thing about designing our own practice is we get to choose what we offer to the patient. So with every visit, you get one-on-one care with us in a private setting that lets us individualize your treatment, go over all aspects of your life. We look at mental, physical, diet, everything, and we tailor our treatments to you. We also offer cold plunge, red light therapy, and just the latest technologies to help you work on longevity and health.
Anybody who has pain, not being able to reach the goals that they want to do, whether it's as simple as like walking for a few minutes or training to do a marathon. Anybody is a good fit for this because not only is it good for health and recovery, it's good for wellness as well.
We often see entire families. We love seeing people from beginning to end. We'll see babies right when they're born. We'll see mamas during the whole pregnancy. We see grandparents and parents. We love letting people live the life that they want to live. Libertas can help really anyone. What we look for is dysfunction in the fascial system, as well as body mechanics, environmental stressors, dietary stressors. So if you are a human and you use your body and you want to be better, we can help.
Libertas can help you with anything from head to toe. Anything that hurts, feels tight, that just doesn't feel right. We even see a lot of folks with low energy. So anything that's impeding your day or your ability to function and live a great life, we love to help with that. Libertas does not do home visits. As far as medically and pathology-wise, we see about anything. We've had several situations where you talk to a patient and you're thinking, it sounds pretty far advanced, we really don't know if we can help. They come in, we assess, and come up with a plan, and then actually start treating, and they do actually phenomenal.
So for your first visit, before you even come in, we'll have already sent you a portal link and we'll already have you fill out all your consent forms and your medical history. That gives us a chance to read all about you and have questions written up. That way when you're here, we don't take time with paperwork. So then you will come in, you'll come into a private room and you'll have an hour with us. And at that time, you will ask us any questions that you have. We'll do a full body assessment. We'll talk about maybe things that weren't in the medical history, and then we decide from there. We decide what your goals are, what realistic goals we're gonna have with you, and then we make a plan.
So cold therapy that we have here is called the cold plunge. And so it's basically a bath that's set to about 45 to 50 degrees, and you simply just get in it and then you practice mental toughness, breathing, almost like a meditative state.
But our cold plunge, which is unique to nowhere else in mid-Missouri, is ours is infused with ozone. And ozone is antibacterial and antifungal, and so it's really good for boosting your immune system as well.
The reason I think somebody should do cold therapy is because it's tough. It's mentally and physically challenging. When you get into the tub, your body freaks out. And the world that we live in, we're used to doing easy things. So when you do something that's tough like that, the rest of your day seems a lot easier. It's a nice meditative mental challenge that is just good for your overall health and well-being.
And science shows that cooling your trunk and your body increases your sympathetic nervous system, which is our fight or flight. So doing breathing activities while you're cold will help you be able to control your nervous system. Science also shows that putting cold on your face increases your parasympathetic nervous system. So that's why cold showers can be really relaxing and invigorating, but sometimes in cold water, people have a panic attack. So it's just a really great way to help people learn how to control their emotions and control their breathing in a safe environment. putting yourself in cold water will increase norepinephrine, which is the hormone that's released in your body. And then when that happens, you get endorphins and you get this feeling of euphoria. Research shows that 2 to 5 minutes of cold submersion actually increases brown fat production and decreases white fat production. Brown fat is a metabolic machine. You can access those calories way easier, and it actually doesn't deposit around your organs and stuff like that. It also causes norepinephrine release, which is an endorphin. And so it's very similar to doing some medications, but it's a natural, and it's your body doing things to heal itself and make you a disease, a pain fighting machine. We see a little bit of everything. Because we treat fascial dysfunction anywhere, we see headaches, dizziness, TMJ, neck pain, back pain, pelvic pain, foot pain, anything that can hurt or is off. We also see some of the more interesting things for this area. Like we see a lot of Lyme, Epstein-Barr, injuries from medications that maybe cause some neuropathy or nerve pain, stuff like that.
We see a lot of stuff, anything that ends in itis. So for example, lateral epicondylitis, shoulder bursitis, gastritis, GI system, we see a lot of that because your GI system itself doesn't really know how to tell you that it's hurting. So a lot of times folks will feel that in different parts of their body. So the hips and low back, for example, are common dumping grounds for the GI system. And so we will see a lot of that here as well. Counterstrain is the technique that we use. It addresses the fascial system of the body. So what we're looking for is different fascial restrictions, from head to toe. And sometimes if somebody comes in with shoulder pain, we're assessing not only the shoulder, but all the fascia around it. So they may have shoulder pain that's coming from their head. And so when we're looking at the fascia of the head, for example, we will try to treat the head to help the shoulder.
Fascia is around everything in your body. Fascia is around every artery, nerve, vein, bone, organ, your skin. Everything has fascia. Fascia is contractile mechanically, like with the trauma, but also chemically with stress or with diet. And so when your body gets a dysfunction in a certain area, we can say, okay, is that fascia around the artery, the nerve, the vein? And then we can calm it down. Because like Josh was saying, sometimes your bicep gets tight, but it's not always your bicep. Sometimes it's the artery under the bicep, but muscles aren't as smart as nerves and veins and fascia. So your body will tighten things to fix it.
So it varies wildly because it depends what phase somebody's in. So if they're in a lot of acute pain, they may just still be resting, icing, and just letting their body heal. But eventually, as you start to feel better, your homework may be as simple as just going for a walk, beginning some actual stretching.
Women's health is something that I feel really passionate about, and I do feel like it's really underserved. Women's bodies are absolutely amazing, and everyone thinks that when it's time to have a baby, you can just get pregnant and have a baby. And for a lot of people, that's how it works. And for a lot of people, it's not how it works. And there are fascial things that we can do. We can treat blood flow to the female organs. We can talk about food sensitivities and how that might be changing your hormones. We can also talk about that time you had a bike wreck when you were 6 and landed on your tailbone and now you have pelvic spasms. No one ever really gives the pelvic floor attention until they want to grow and then a baby come out. But sometimes you need to do some groundwork before that baby comes out. And sometimes you need to do a lot of groundwork after that baby comes out. A women's wellness exam is a thorough assessment of the whole body, including the pelvic floor, internally and externally. With that, we will look at the anatomy, we will look at muscle strength, muscle tension, and there are signs and symptoms of your body that show us that your hormones are where they're at. That does involve a full-on pelvic examination, but you are educated throughout the whole thing, and we kind of talk about any concerns, any pains, any things that you didn't even realize you had until we're in that position. We love treating kids. For some people, birth is the most traumatic thing you'll ever go through. Your skull is squeezed through a very small opening, and then there are things that just happen. You know, kids are a lot of cartilage, kids roll off the couch, kids fall when they're walking. Babies are really fun to treat because they respond so quickly, and it changes the trajectory of their growth. And children are just so sweet because they want to move and they want to be well and they want to be healthy, and we love to help with that.
So wellness is super important to keep the body running smoothly. Just like you get the oil changed in your car, you check the tires, you rotate the tires, you want to do that with your body as well, because we are highly active individuals, and if you're not keeping everything running smoothly, it'll break down a lot quicker, more frequently, and that's just not ideal for us.
We were designed to do hard things, and so a lot of times we push our bodies. Now for some people that might be rock climbing, for some people that might be vacuuming, but either way we can cause trauma and damage. Sometimes that is breaking a bone, but along that bone you have a fascial sheath. You also have blood flow to and from the bone and nerves to and from the bone. So maybe when you were in 5th grade you broke your bone and now you're 45 and you have some carpal tunnel. Well, those things that if you treat the fascia when you're young, you can prevent damage down the line. It's a chain reaction. And so we love to get people in before they're symptomatic, because a lot of times we can treat these things out, and it's called mechanotransduction, and it fixes things down the line, or can prevent things down the line. It's really exciting. I would say the most common thing that we treat, that we get a lot, that most people don't refer to PT for, are sinus congestion, sinus headaches, and constipation. We treat those all day long. And fascia in the sinuses or in the colon or in the pelvic floor, I mean, you can drain someone's sinuses and their ears really quickly.
Migraines is another really big one. A true migraine, that's another really big one that's not commonly referred to for PT. The cranial scan really allows us to hone in on what's going on. The biggie with it is, especially with folks who've had hip pain and they've tried numerous other things. They've tried an injection, they've tried stretching, they've tried strengthening, and they don't know where else to go. Well, the cranial scan allows us to narrow down which system is involved in that. So whether it's the arterial system, the lymphatic venous system, or even the visceral system, then we can further hone in on it even more based off where the scan tells us to go.
So we're looking for tension in the cranial bones. And so what we do is we scan, we find tension, we say, oh, that's a certain part of your body. We go and treat it, we come back and check the scan. And your body says, oh yeah, that's clear, now you need to check this. And so instead of guessing, we can say, oh, it was the artery, oh, now it's the vein, oh, now it's this. And it really you can get a lot of treatment done in a session for really unique, specific things. Everything is either a medicine or a poison. Not to be that dramatic, but it's either good for you or bad for you. And it's like with your car. If you have a gas car, you would never put diesel in it. The same is true for your body. Just because you don't get hives doesn't mean you're not sensitive to things. And so it's really good when we're looking at inflammation in the body and we're looking at pain. We also want to consider, okay, how are you fueling your body? Are you drinking water? Are you getting salt? People kind of think salt is not good, but salt is actually really important for all of your body systems. And so this is another way we just individualize our care. We talk about things that we do to decrease inflammation. Some of that is intermittent fasting. Some of that is, supplements, but those are things that we will just talk to you about. We don't accept insurance because we don't treat insurance companies. Insurance loves to dictate how many sessions you get and what we can do during those sessions, and that is not what we do. Every single session is individualized to the patient, and we are the ones that get to decide with our patient what their goals are and what the outcome they want is. And so because of that, we are cash pay.